realize that this infection is raging in an area, we call for a particular type of intervention, which we must then make sure that intervention helps us to deal with the numbers until we can actually stabilize. Because we have said that we'll never get rid of the infection completely. What we want, the numbers must be so low that we don't have our centers overwhelmed. So the difference between the two is that they have started, in Witzenberg, they have started to actually get the numbers reduced. But in this part, Drakenstein, the numbers are still rising. We expect that the approach must be the same, and that ultimately the numbers must ultimately stabilize. But the whole of Cape Town Metro, we expect exactly the same. That's the issue that we've been emphasizing. Strong interventions with our health teams and a very clear line of who are the people who are positive, and we take them for isolation, we take others for quarantine, we manage those who are sick, and make sure that on a day-to-day basis we focus on that. But in addition, we need social behavioral change with all members of society focusing on that. That's the formula. It's going to be like that. We're going to repeat it. We're going to do it everywhere until we can actually get over this thing. And that's why we keep saying we shouldn't fear the virus. What we need to know is that it's our conduct that's going to determine how well we're able to do in the campaign. The issue of testing, I now must accept that every one journalist is going to ask me the same question, same way, every day. I answer it the same way. I'll answer it again for tomorrow. The issue here is that with over 700,000 tests, it's a lot of tests. We would be at some point bound to come across those kinds of hitches. When the whole world is looking for these tests, and therefore we run into challenge with that, we must just accept that we're not manufacturing our own, and therefore we don't have enough. But when that happens, we want to make sure that we refocus on our targeting, on how we do the test and how we use the test, so there is no patient who needs the results immediately to direct the cause of clinical management will actually be compromised. At the same time, there is clinical management of any patient. If the patient has to, the clinical management means that the doctor who is looking after the patient makes a judgment call, and the test generally becomes a supplementary support for the doctor. So if we've got the test, all and good. If the tests are delayed, there's a way of managing the situation, and we've all discussed it, that if you got a patient who's got symptoms and needs to be treated, the doctor will assume the patient has got the infection and treat until the results come. But if someone has got symptoms, they are mild, and maybe they don't have symptoms, they don't need treatment, all we're worried about is whether they're positive or not. Treat them as positive and make sure that they're well isolated so they don't spread the infection, make sure they are all supported, and make sure that they actually, over a period of 14 days, even if they didn't have symptoms, it's only safe to release them after 14 days. Except if you were able to find the test which could have indicated that you might have caught them at the latter end of their infection. So as we speak now, we're actually clarifying the guidelines just to make sure that anyone who is awaiting test results does not get compromised and does also not compromise the community that they are going into. But I'm saying we're going all out. I will not give you details. We're going all out to make sure that we source as much of the kits as possible. The issue of the backlog is a temporary problem for us. We will be able to solve it, and over a period we'll get that one solved. But having solved it, it will mean that we can't expect that it won't arise in the future. It will arise again in the future. But at the same time, we also don't want any patients' lives to be compromised. So I'm quite comfortable that the approach, both from the management of various provinces and our Ministerial Advisory Committee, our approach is quite structured and standardized, that there will be no patients whose life will be compromised by the backlog. So the backlog, yes, is there. We'll solve it. Thank you. The tiger bag issue, look, the management of the hospital is obviously going to be in the hands of the how the provincial department is managing it. Where there are a number of people who are infected, we need to make sure that they get isolated and they get out of the way, and then we must make sure that the hospital is prepared so that other patients who come in don't get compromised. And that's the approach that we're going to take.
SABC?
Thank you.
Thank you, Minister. Minister, sorry, my question...
Let me just
give you a moment.
Minister,
my question latches onto my colleague Ronald. There's a backlog in the Eastern Cape as well. If you just want to comment on that, I understand it's in the region of 22,000 tests. That's the results that are awaited. And ultimately, how many people per day would government like to see being tested? What is the goal that you're working towards? And if you perhaps have today's statistics for us, please.
We do an average of close to 20,000 tests every day. That's what we have managed to keep stable. So it would be sometimes 17, it would be 23, but it's around that figure. The backlog varies day by day. For example, right now, our backlog, I was talking to MEC because we pushed a lot of additional kits, test kits, to actually try and deal with the backlog here. Really, because this is where 2/3 of the infections are in the Western Cape. But actually, the total number of backlogs, I have to check every day. Now, in terms of undone tests that have not been, processed, that number varies. Okay, you go back down the week, it could have been around 40,000. But right now, I haven't got the today's figure. But the last I checked was around 90,000. Okay, now 90,000 out of 760 tests that have been done, it's a significant amount, but the amount that's been done is much bigger, and our epidemiological analysis does not get affected by that. It's an issue that does not change as it were. The only issue where it might affect is whether if you keep someone on suspicion that they are possibly infected and you don't have the results, you may not know, because you might end up having to keep someone longer than they needed to be kept. But if someone did not, you didn't have the results, and someone spends for 14 days in quarantine and they didn't have symptoms, you've got your answer. The results will come, but your answer is already there. They were 14 days in quarantine, so they didn't spread infection to anybody. The most likely the issue is even if they had the infection and they were not positive, and they were not we didn't have the test, it means when they go out, they are now free to go because the likelihood of them infecting anyone is lower. So all of that means for us that the clinical management is still supreme. So every province, I would say, Western Cape, Gauteng, Eastern Cape, KwaZulu-Natal, we have actually got big backlogs. Eastern Free State, we cleared it unless they build up another additional backlog now. So we will find backlogs every now and again. First few weeks when we started testing, we started having backlogs. When we do have backlogs, we then go out and check who's got the backlog. Is it the private sector or is it the public sector? If it's private sector, we move the specimen from private sector to public sector, get them done. If it's a private sector, a public sector that's got backlogs, we move the specimen to the private sector. Depends who's got capacity to do it. And at the end of the day, it's just laboratory services, irrespective of whether it's public or private. So we look at it like that. And I would say we shouldn't panic about the fact that there's backlogs, because we've gone all out. We've got a good sense of how the infection is raging in the community. We do pick up clusters here and there, and when we do, we focus on those. So the approach is very targeted, that it does not really undermine our campaign and the management of patients. Yes, we want to clear the backlog, but the numbers that we have already tested is quite high, but it is not where we would like it to be. We still want to test more people. So we don't want the public to be too concerned about the fact that today we're reporting there's a backlog. It's a back office kind of work that we're talking about. We'll get it all sorted out. And when we do have it sorted out, still doesn't mean that we are satisfied. It means we still want to test more people.
And just the figures for today, the number of infections, do you have those with you? No?
Okay, I'll have to go look for those. Let me finish your questions.
Yeah, it's going to do it later.
Okay.
The last one is the newsroom. Yeah, the last one is the newsroom.
You ready?
Them touch the on my phone.
On your phone. They're on my phone too.
After newsroom.
Yeah.
Okay, after newsroom, and then the minister is going to do the stats, and then you ask to come and do the thank you. Yeah.
Okay. I'm Minister Yazid from Newsroom Africa. So what is your overview on the Western Cape's facilities? And also, how do you see it needing strengthening?
Okay. We've moved around to various provinces. The key issue that we're trying to look at is the issue of readiness in terms of the approach, the strategy that's being used, and adherence to the protocols. And we've moved around, and I've said even President is coming here. At that level, we are happy with the Western Cape and the Eastern Cape and KZN and Gauteng, the ones and Free State, the ones where the numbers were higher. We are quite comfortable that we also, based on the numbers of patients that we expect, we were concerned that they should be able to build up, reserve bed capacity, and here we actually have the bed capacity. I'm comfortable with that, and we've been to, the city ICC. We've been to rural areas. We said we wanted to see everywhere. What's the situation in rural, what's the situation in urban, and again, I must say that I'm comfortable that enough work is being done there. What do I see as an area of constraint? One, the first issue was the numbers of beds matching the numbers of patients, and that we have agreed that we need the province to be having reserve capacity in case the numbers are quicker than the beds being released. Then we must use the private sector. I just announced here that we are actually finalizing this discussion this evening. When we do, the provincial government will have the liberty to go and negotiate with whichever hospital so that there is no patient that falls into cracks. The other area that I've raised, which has been a challenge that we have discussed, has been the issue of the testing. Now I've explained that. My main issue, insofar as dealing with the issue in the Western Cape, I believe the area that we are now focusing on is the area where we need to strengthen it. The area of clinical management, insofar as it's about hospital care and so on, that the presentation was given to me a while back. I'm quite comfortable there that that's been going on. The area that we're all now focusing on is on the primary health care side, the prevention, the identification of the patients who are positive, and then it's the isolation, it's the quarantine. Now that is what we are all about here, and I believe that we strengthen that. And what also I believe has also been focused on is the intersectoral response, where everybody focuses on the same thing with one message: behavioral change. It's come out quite well. So I would say that on all the areas that we're focusing, we actually think that the province is actually giving the necessary attention, and so we will be getting the president here as well, but we need to just make sure that we keep to that plan, and that's the way to go about it.
Yeah, thank you. The numbers.
No.
Okay.
I'll find my...
Okay. Oh, your phone. Okay.
Yeah, I won't give you everything. I'll just give you probably, because, media, they want the numbers now. If you delay, you get criticized. If they are not correct because you're still calculating, why are they wrong? So, however, let me say I must thank the media, because out of the daily accounts and the focus, media has remained interested in being able to take us through and make the public to be well informed. I've got them.
Can you read them?
I can read mine. Let me see yours.
That's stretch. We can stretch them out for you.
All right. Let me use yours.
And then do landscape. Yes, okay, there we go. Can you?
All right. Okay, you can move away now before I give you my own COVID-19 fix. Okay. Excuse me?
Taking selfies, Minister. Tell us the truth.
No. Look, the numbers we have today, we have 35,812. Okay? That's the latest of the numbers. And if we were to go province by province, Eastern Cape is at 4,324, Free State 299, Gauteng 4,276, then KwaZulu Natal 2,637. Oh, thank you. You're very thoughtful. Now that solves it. So then Mpumalanga 132, Limpopo 193, Northwest 271, Northern Cape 91, Western Cape 23,583, and so that gives us the total of 35,000. At this stage, 761,534 tests have been done, of which in the past 24 hours, 18,792 tests have been done. It will take us a while to reconcile the record of those who have passed. We're not ready right now, so we still have to do that calculation and get all the reports later. But now that you asked for these figures, that's all that we can share at this point. Thank you very much.
Okay. All right. Thank you. Thank you, Minister. I'm going to ask Dr. Ivan Meyer, the MEC for Agriculture, just to do the overall things on behalf of the Western Cape government. As we go, as we go inside, I think the first thing we have to go through. No, let's now. What we have that
Werk hard, hè?
Hallo, moet je die gaan Alright, dankie. Oh, vanmiddag is nou af hoor.
Sila was nog niet benaderd.
Nee, ik ga nog niet. Nee. I think now, I'm going to just check. I think they're done with the live now. I think so, Alright, let me see. I'm holding the mic and people are writing me, and there's a lovely photo of my big red ass from Richard Newton.
That's a nice picture. Come on. You particularly see that more people are vulnerable.
All right, the Health Minister there, Dr. Zweli Mkhize, just giving us an update on the latest figures, reporting that there are now 35,812 cases. He wasn't able to give all of the stats, including the latest death statistics, but he's there in the Western Cape, basically inspecting the isolation units and quarantine units that have been set up for cases that are expected to charge up there. So now we're going to proceed with the bulletin. ANC Chair in Kuruleni